Okay, so my name is Christophe Bintener. Thank you very much for introducing me, Christine, and Helen RochfordBrennan, the chair of the European Working Group of People with Dementia, joined me for my presentation. Thank you very much for that. Thank you very much for joining us for this session. My presentation today will revolve around the participation of the European Working Group of People with Dementia in the outcomes work of the Roadmap project through consultations in which both them as well as their supporters participated separately. Although usually the supporter only attends the meeting to provide support to the person with dementia, in this occasion they were invited to participate on their own right in order to have some comparison in opinion. First of all, I would like to mention that my role within Roadmap very much focuses on Alzheimer Europe's position as a co-leader of the project's communication and dissemination work. The following presentation focuses on work to which I have contributed to, but the main credit goes to Mia Nelson and Amanda Lee from the University of Edinburgh, as well who co-led the activity, as well as my colleagues Anna Diaz and Diane Goff, who are coordinating the European Working Group of People with Dementia. I would therefore like to invite you to address more specific questions, either to Helen about the involvement of people with dementia in research, so either to Helen or to them. Anna is also going to present at a following ethics session on the Roadmap project, so you will have the direct opportunity to follow up on that if I should not be in a position to address your questions. The end of this presentation will also include their emails, and a link to the website where there is more information on the European Working Group. I'd now like to give you an overview of the sections of this presentation. First, I will introduce the aims and objectives of the consultation, then present the European Working Group. Here, Helen will introduce you to some of the benefits of involving the European Working Group in research. After that, I will give you an overview of what and how we prepared for the consultation, followed by a few examples of the main questions we addressed and methods in doing so. The aim of the consultation was to ensure active involvement of people with dementia in design, analysis, and interpretation of activities of Roadmap's outcome work. The objectives were, on one hand, to receive feedback on a survey that has already been mentioned by Claire, designed to identify which outcomes constitute a priority for people with dementia, whereby the emphasis was here on the design, content, but also the layout of the survey. So this survey had been launched both online as well as used in print version in memory clinics. On the other hand, the consultation was set up to help the work stream in gaining insights based on the personal experience of why specific outcomes might or might not have been prioritized in the survey and why they have been prioritized, right? So adding more qualitative insight into this quantitative approach of doing a survey. The primary analysis of the consultations was undertaken using a thematic analysis approach to explore why outcomes were important. And again, that was work being done within Edinburgh by Mia Nelson. So on my next slide, you can see an overview of the 2 days schedule. The questions during the consultation revolved on the topics in line with the specific core aims of the Roadmap project, which was on one hand identifying disease progression, but also staging Alzheimer's disease and dementia. This was addressed as part of the group discussion on disease progression, and identifying what constitutes a meaningful delay in disease progression. 1.5 days were dedicated to the discussions with the group. The discussions were broken down into sessions which allowed for rest and refreshments. The duration of each session was between 1.5 and 2 hours. The consultation was carried out, as I said, with 2 separate groups. One of the groups were 7 of the supporters, and one of the groups were 9 members of the European Working Group, plus one of the supporters who helped with the translation. I would now like to introduce you to the European Working Group, which was launched by Alzheimer Europe and its member associations in early 2012. The group is composed entirely of people with dementia in a mild phase, who are nominated by their national Alzheimer organizations and associations. All the members are both free and able to decide whether or not to participate in such consultations or sessions. And the group mainly works to ensure that the activities, projects, and meetings of Alzheimer Europe duly reflect the priorities and views of people with dementia. During the group's first terms of office, so 2012 to 2013 and 2014 to 2016, the members of the European Working Group actively participated in the Alzheimer Europe conferences and gave keynote presentations in the European Parliament. In addition, they contributed to several consultations for different European projects where Alzheimer Europe is involved in. And yes, the members of the group have also contributed to research conducted by external organizations on topics such as outcomes measures that are meaningful to people with dementia and their carers. Social health and people with dementia as peer researchers. They have attended various international dementia events and given numerous interviews, both in their countries and internationally. The group operates independently with members electing their own board, which happened yesterday, and setting an agenda of activities. The chairperson who joined us for this session is Helen RochfordBrennan. In that role, she also serves as an ex officio member of the board of Alzheimer Europe with full voting rights. She was recently awarded an honorary doctorate of law from the National University of Galway for her major contributions in research. Helen and I thought you'd be interested to learn a little about her perspective about being involved in research and what might be the benefits of involving the European Working Group in projects such as Roadmap. Maybe also, if we have enough time, the key messages for researchers when involving people with dementia. Helen, thank you for joining us.
Thanks, Chris. It's great to be here. I just want to say that I want to just give you a little bit about Helen pre-diagnosis. Helen was always interested in good data. I was a businesswoman, but I was also a big activist in Ireland, trying to make our country better and our region better. And so I was always interested in collating data. And so for me, after my diagnosis, it was obviously a natural progression to look at research. And I've been privileged to be involved in lots of pieces of research through Alzheimer's Europe, and indeed to work with Roche, which I'm really grateful for, because it's always good for pharmaceutical companies to hear what medicines do or do not for us, and to be able to get academics and right across the board, pharmaceutical scientists, everybody to understand what our lives are like on a daily basis, just to look at us as human beings and just to see what our illnesses are like. And we're all different. We have all different types in our working group. We have all different types of dementia. With Roadmap, I suppose I was wondering first for myself, you know, when you hear the word real world, you think, oh God, this is magnificent. It's real, you know. It's going to be now, today, we're going to have what's happening. And so I suppose when we met first, I wasn't too sure, to be honest. But as it progressed and we became involved, and for myself when I became involved, I realized that we were on a new path, and a path that was going to be really important to all of us with dementia. And one of the first things that was quite interesting was how researchers view us. Well, so we had a little educating to do, that we could actually talk to you, that we were real, and that we could actually tell you what it was like to try and put down a fire with a dishwasher tablet instead of a firelighter, or to take a cake out of an oven with your bare hands, and So we had a little educating to do, which was really good because the researchers had never experienced working with us, and so therefore it was an important start. And we know you are professionals and you do a marvelous job, and that we are grateful for your expertise. And we found it, I certainly found it, a very rich and rewarding experience, because we were, as chair of the group, you know, I was able to lead the group into engaging with you, and we all had our own voice, and we were finally able to give our own voices to, as Chris said, to researchers on a one-to-one, and if we didn't feel like it on some days, we didn't have to. But I mean, we know that it's real world data, and it's, as I said, it's really enriching for all of us to be involved in it. We know that it's going to inform policies, and so I cannot tell you what that means to people with dementia. There are no words to tell you how good it is that all of you are going to inform policy based on the research you're doing, because we need changes in policy, and we need real-world changes in policy. And so the quicker we get to that, the better. Collected data, as I said in the beginning, collecting data, but collecting real data is so important. And over the years, I've seen so many different pieces of data. And many days we wonder in the European Working Group, what has happened to all the data that we have given in various projects over the years? And sometimes we hear back, but to tell you the truth, guess what? We don't hear back all of the time. So what has happened to the data and where it has gone to? So I would like to say to all of you, no matter where you are in research, please feed back to us whether it was useful or whether it wasn't useful. And I'm bringing that message to you from all my colleagues. Look, we love new ideas and new visions, and we think it's what we need anyway. Today, maybe the older methodologies didn't appear to be working, you know, so maybe today the new methodology of real-world research is going to work. And we would say to you is, involve us early, you know, because the earlier that you are on a project for people with dementia, the earlier, you know, when you start, we want to be involved with you from the very start. And sometimes with, you know, with designing research, as I'm sure you've all learned, that if you don't involve us from the beginning, then we're trying to understand jargon, that language we don't understand. We're not academics. We come from a varied backgrounds in our lives, but we honestly want to have the language right for us, you know, that we can understand it and that we can give you proper answers, the answers that you were looking for. So I suppose there's another, I'm very busy busting myths today, you know, so I'm on the third one now. So this is about our level of education and who we are as people. And I think that those of you that have met us and have talked to us will understand that it doesn't matter what our educational level is, because we have a real contribution to make. We have a contribution to make what our lives are like and what happens every single day. And as I keep saying, you know, we're people first, and we know that from what researchers have told us, that the contribution we make is quite invaluable to you. And it is also invaluable to know that today, every 3 seconds, somebody around the world is being diagnosed with the illness. So, you know, as I often say, it's going to be your family, your friends, or possibly you that's going to have this illness. So whatever research you're working on, I would ask you to just keep that in mind. There is no, right now, we know there's lots of research being done. One day it's tau for me, so I look in the mirror and I wonder, is it tau? The next day I wonder, is it my bloods? The next day I wonder, is it the environment? Because we are smothered with ideas of what it might be. So we think that you all researchers working together can really can help us. You know, at the end of the day, there's only one thing we want, and that is the quality of life. And I think you touched on it earlier on about, you know, looking at us as a whole person. What's important? Yes, our medications are important. Yes, you know, our exercise is important. And our health and many other areas is important, but there's nothing more important to a person with dementia than a quality of life. So I've learned over the years that setting a positive message, which I think Roadmap are setting, is a great way of changing public perception on research. And it has, for us in the European Working Group, it really it is changing public perception. And we can go back to our own countries and talk about what it's like. We know that the researchers at times have probably found it difficult with this, but we are delighted to be involved. And it is such a rewarding experience to be involved with you, because we know that you are going to make a better life for us. And we want to make sure that the clock is not rewound. You know, over and over, there's people in this room, many of you are doing research, which is maybe to us something similar. And so what we like about Roadmap is we hope that it's going to pull different types of research together, and that it will impact on our lives. And we want to keep informing you, and we want to keep being involved with you. But most of all, we want to see this put into action, because I know we see that there is going to be more stages. But honestly, that is the one and only thing that we ask for, is that it is taken forward and it is put into action. Because like any good research, you know, we don't want research sitting on the shelf, collecting dust. Don't let it end here. Keep at it. You are going to make the lives of people with dementia so much better by continuing your work. And I think that might be enough for now, Chris.
Thank you very much for these wise words. So, as I said, I also would like to give you an overview of the preparation of the consultation and some of the methods of how we carried it out. First of all, it was very important to have detailed schedules with all the questions in advance. As Helen already said, it is crucial to really have very clear language and to bring your questions to the point without too much ambiguity. And when talking about outcomes, it can be a little bit challenges to not do so. Other documents, so we sent a lot of documents to the participants a few weeks in advance. And we also had a high-level overview of that rather large consortium of 26 partners and 8 work streams, including also some of the lay explanations of key concepts in advance. This was also repeated during the day of the consultation itself. In addition, the 2 consultations, which were both led by 2 moderators, kicked off with an icebreaker that I'm going to show you later on. As I already told you when I provided an overview of the schedule, the key topics revolved around disease progression and what constitutes a meaningful delay in disease progression. In order to provide the ground for a fruitful discussion, the 13 questions have been sent to the group as well. So here you can see a list of materials we used. We also used an exercise with sticky dots. The red and yellow cards were handed out to the participants within each group to facilitate exchange. The red one was to ask the speaker to slow down, and the yellow card was when someone wanted to say something. We found that engagement with the group was enhanced through a few preparatory measures. So as an example, we provided the written information in an accessible format where we followed dementia engagement and empowerment project guidelines. This presentation is also going to be uploaded within about 2 weeks to the Alzheimer Europe website, and there you can also find the links. Here you've got a photo of the morning during the first day of the consultations before the 2 groups split. After the introduction to the project and key concepts, as well as questions and answers, we carried out the consultations. So as I told you, we used an icebreaker because sometimes it can be a little bit hard to get a conversation going. You don't need to read this through, though. We then explained that dementia is traditionally described in terms of stages in order to introduce the first questions, and asked which ones the participants are familiar with. And if referring to stages doesn't work for them, how they think progression could be more meaningfully described. All of those were then written down on a flip chart. And Then another of the methods we used can be seen in this example. Here we picked up from the last topic were examples on how the participants could tell that someone's dementia is progressing. Participants were then each given 3 sticky dots and were asked to put them next to changes that might indicate a progression from mild or early to a mid or moderate stage of dementia. Then we did the same thing with the red sticky dots to identify which changes might indicate a progression from a mid-moderate to a later or more advanced stage of dementia. So here you can see another activity that we conducted. So we had a full list of 13 outcomes that we brought from the work package 2 first exercise, the outcomes list. These should then be put into one of 3 concentric circles indicating how important the respective outcome was. The aim of that activity was to help identify in future if there has been a meaningful change in disease progression, but also to help the research team to understand which types of outcomes to prioritize. Here you can see a few further considerations that also proved useful during the consultation activities, and I would like to especially highlight that the atmosphere of trust and a positive environment is very crucial, because if that's not given, the consultation is not going to work. After the whole consultation, so there is a very long deliverable on the roadmap website where you have the opportunity to really read through every detail and every question of the whole consultation. So you can have a look at that if you would like to have more information on it. After the consultation, we came together again, had a joint feedback session, and so there will be also future involvement with the European Working Group for a subsequent peer-reviewed publication to ensure that their contribution is properly acknowledged. And well, that's it. Thank you.